Hey everybody, how's it going? This video has nothing to do with music again. This video actually has something to do with medical marijuana, right? And before I get into the whole medical marijuana thing, I want to kind of let people know a little bit about what's going on my end and why I'm talking about this. About 3 years ago, I ended up getting diagnosed with multiple sclerosis, and I didn't know that that's what I had. I just thought I was having some eye problems or something. I got some chemical in it or something, because my left eye, I was kind of going blind in it. And you know, I was having pain in my foot, but I attributed it to, you know, bad shoes, and then I started getting numb, and I started having cognitive issues, and it screwed me up for a while. This is one of the reasons why I wasn't doing videos for a while, because it kind of turned my life upside down. But luckily, a lot of the stuff that was damaged or whatever, my body healed, so I've got my vision back and everything. Everything's not 100% of what it used to be, but it's pretty close. It's not bad, so I'm doing pretty good. But what is multiple sclerosis? Well, multiple sclerosis ultimately is where your immune system starts destroying your central nervous system in your brain. That's ultimately what it is. Your immune system will start destroying the myelin sheath that's on the neurons that are within the brain, within your spinal column. And when those end up getting destroyed, the myelin gets destroyed, it short circuits your nerves and your neurons. It causes things to misfire. It causes certain things just to stop working. It's almost equivalent to you know, opening up a TV set or something and then just kind of getting a squirt gun and squirting, you know, on the circuit board. And is it going to break the TV? Who knows? Is it going to hit a circuit that really matters? Who knows? Is it going to end up making it where, you know, there's sound but there's no picture? Who knows, right? And that's one of the problems with multiple sclerosis is it's not predictable. You don't know what's going to happen next. When your immune system attacks part of your brain or part of your spine or something along those lines, it's just like covering your eyes like this and getting to a dartboard and, you know, aiming, and whatever every number on there would be a function of your body. It could be, you know, your breathing, or it could be walking, it could be your vision, it could be swallowing, it could be anything, right? And then if it hits it and it damages it, is it going to be permanent or not? It's a stressful disease, and there is no cure for it, and it sucks. But they're working on it. You know, there's medications that they have that slow the disease down. Once again, it's not predictable, and you can have one MS attack, heal from it, never have another one as long as you live, but that's kind of rare. You can also end up getting multiple sclerosis, and then just within 4 months you're in a wheelchair, and within 6 months you're dead from pneumonia or something. That's possible. But typically speaking, more times often than not, you get what they call a relapsing version of it. And so you'll end up getting an MS attack, and it'll be shitty, and then it'll end up going away, then you kind of heal from it, and then you'll end up having another attack, and each time could be the same spot, different spot, who knows. But it's a relapsing, remitting type, and that's what I have. And it can turn into a more severe case, and I don't want that. I don't want that. But anyway, that's me. I've got multiple sclerosis. Now, they don't have any medication to really help you with the side effects of multiple sclerosis, right? So if you end up having a whole bunch of weird nerve spasms and your arm shaking, or you have slurred speech, or you have nerve pain, there's really nothing that anybody can give you. And they have found that with some people, not all people, but with some people, depending on the strain and everything like that, if they ingest some marijuana, or they smoke some marijuana, it actually ends up helping them. It takes some of the pain away, or all of it. It helps with the speech. It makes them where their quality of life is much higher. And because of that, really, and there is plenty of evidence to support this, they should legalize it, and then they should start making drugs and stuff like this, the pharmaceutical companies, to help people, you know, that have these problems. But because of political bullshit, of course, they won't do it, because there's money to be made as long as it's illegal. they're playing both sides of the fence, and they get paid both ways. Not only do they make sure that there is marijuana and they're getting paid, but they're also fighting marijuana and they're getting paid, right? So there's too much money to be made, so they're not going to make it legal anytime soon, I don't think. And I think it pissed them off actually when Colorado and I think it's Oregon or Washington ended up legalizing. I think it pissed them off a lot. But it's still federally banned, right? This is a problem. In California, you can have your medical marijuana card, and this is issued by a doctor. Now, it is not a prescription. It is not a prescription. What it is it's a recommendation saying that given this person's medical history and what they're going through, we think that the use of marijuana is actually fine, right? We think that's a good thing. But because it's federally banned, they can't write a prescription, so it's a recommendation. And so there is a difference between that. And of course, there are people out there that use it for the other than just multiple sclerosis. There's people that have severe migraines that use it. There's people that have AIDS that use it. There's people that have cancer that use it. There's also people out there that fake illnesses so they can get their card and stuff like that, or they make up something that's stupid like, oh, I've got severe insomnia. It's like, I have problems with that kind of shit, because I'm like, these people are legitimately sick, you know, like myself or whatever. Like, we're legitimately ill, and you know, you guys in a way I feel like are taking advantage of something that it's pretty low budge, man. It's like, if you're just going to be a stoner or whatever, just go buy the fucking weed. You don't need the card, you know. But and I don't have a problem with people smoking weed. I just don't like, you know, it's not legal yet. And if there's the possibility that what these people are doing is jeopardizing, you know, other people that actually could use this stuff, you know, it kind of pisses me off a little bit. But anyway, the way that you end up getting your card is you go to it has to be a licensed physician. You end up going to this doctor, and then you give them your medical history. They give you a quick examination or whatever, and depending on what your medical history says, they'll say, okay, we're going to write you out the recommendation. Now, my neurologist could not write out the recommendation because he works for a corporate medical center, right? And even though he probably per se doesn't have a problem with it, he can't do it because the company he works for will not allow it. So you have to, a lot of times, you're going to have to go to a private practice in order to get this done. There's plenty of doctors out there that'll do it. They'll do it for $75, $50, $100 or something like that for a year, because you have to keep getting it renewed. And as long as you can bring a medical history that's legitimate, they won't have a problem doing it, because they feel you're suffering, but at the same time, they know that this is a great way for them to make money, and all they have to do is sign a piece of paper, right? So don't worry about that. Now, after you end up getting your medical marijuana card, or you don't really have to have a card. You just have to have the recommendation. It's just as good, except the card you're going to be inside the state's system. So if a cop pulls you over and they find weed on you and you have the card, it's in the system. It's just like a driver's license in a way, where it's fast like that, and they'll just let you go, whatever. Unless it's a federal police officer, then they're gonna give you grief. But as far as that goes, that's cool. But if you have the recommendation, if the cop wants to be a jerk, they can still arrest you or do whatever. But as soon as they verify it, they're going to release you, right? It's just the card makes it where it's just a lot faster and easier and less grief, and it's more official. But you don't have to have it. That's completely optional. It's up to you. So the big question is, you know, does it work? After I get my card, then what? How much am I supposed to smoke? And all this other stuff. In California, you can grow your own if you want to, but I wouldn't recommend doing that. You know, it's too much of a headache, and even though you can legally do it if you have your recommendation and stuff like that, it's a headache, and you know, depending on the neighborhood you live in and stuff, it can create a lot of problems, right? So I really wouldn't recommend doing it unless you have a place that you know no one will ever know. You know, that's at least for me. I just don't think it's a good idea. But if not, you can go to a dispensary, and even though the dispensaries, you know, they're not going to have a storefront like Walmart, but there's plenty of places that they call a storefront that you can walk into. It's actually a dispensary you can walk into. You can find them on places like called Weed Maps or whatever. What they'll do is they'll want to have your recommendation number that the doctor ends up giving you. And what they do is they verify that. There's a computer system. They'll check it, they'll verify it, and as soon as they know for sure you are who you say you are and it's legitimate, from there they'll give you where their address is and all this other stuff. You go there and you can pick out whatever marijuana that you want. It's expensive. The weed that you get at a dispensary is very expensive. Compare what you get on the street. But the stuff that they have inside the dispensary is usually of a much better quality. You don't have to worry about molds and shit being on it, or, you know, we used to call, back in the day, used to call it Mexican brickweed. You don't get stuff like this. Usually the stuff is hydroponically grown or whatever. A lot of times they'll actually send out samples. It'll be tested, then it'll come back, and from there, that way you kind of know exactly what the THC level is in the CBDs. For people that are ill, like myself, I always look for something with a high CBD content, and the CBD is really the painkiller. That's the painkiller, and what's also great about it is the CBDs actually have an psychoactive effect. The THC is the thing that makes you high, but the CBD, if you have enough of it, actually counteracts the THC. So you can smoke it, and there's very little high from it. But as far as your nerve problems and everything like that, a lot of them dissipate. So if you are sick, you should be looking for the CBD. If you have pain, you should be looking for the CBD. Don't look for the THC, right? There's people that will use it because it makes them hungry, right? So if like a cancer patient, AIDS patient, stuff like that, they'll give it to them because it makes them hungry, it helps them eat. If you talk to the person, they call them a bud tender at these places, dispensaries. If you talk to them, some of them know a lot and some of them are just stoners. I mean, to tell you the truth, it's like it's best to do some research yourself before you go. There's plenty of stuff on the internet that will tell you about, you know, different strains and what their effects are, but everybody's body chemistry is different, and just because, you know, 50 people say this is how they react when they smoke it doesn't mean it's going to work for you. You're going to kind of have to experiment by getting a few different strains, seeing what works for you. Typically there's two strains. There's more than that. When I say two strains, there's actually two main types of marijuana plants. There's indica and there's sativas, and typically you're going to hear somebody say a sativa is more of a head high, right? And what they mean by that is it's more psychoactive, and you might get full of energy. You might it's more of what you would expect weed, I guess, to be as far as like the psychoactive effects. And then the indicas are usually much more mellow and relaxing, and you know, they call it a like a body high, or you're a couch potato after you smoke it. Then there's lots of hybrids where they breed these two together. But you know, what you have to do is figure out what's going to work best for you. And you know, I ended up getting 6 or 7 different strains. It's expensive, right? But if you find the strain that works best for you, you just stick with that strain. And as for me, I don't really even smoke it that much. I mean, and when I say that much, it's kind of like the only time I ever do is when my MS is acting up. The last time I had any was months and months ago. I mean, just to let you know, I mean, and even then I only smoke enough to get the numbness to go away, and that's it, because I don't want to be high. I've got things I have to do. But the high only lasts for about 2 hours, about 2 hours or so. And sometimes some of the strains, I don't like the way I feel on them. Right? It almost makes the situation worse. Then there's other ones that are kind of good. Question some people might ask is, does it work? Kind of. For me, it kind of works. In other words, it helps with the numbness. It helps with the pain. Does it take it away completely? No. But at the end of 2 hours, when it wears off, sometimes it kind of seems like whatever was numb, it seems number now. But I think that could just be a perception thing. But I've noticed a difference using it. The quality of life is better, right? And you know, as soon as you know you can tolerate, you know, what's going on or whatever, again, then you can go ahead and you can, you know, stop smoking or whatever. Because like I say, everything in moderation. Let's see, what else do people do? Okay. You're going to get, as soon as you get your medical marijuana card or whatever, you're going to get sucked into the world of stoners. And the majority of stoners are really nice people. They're really nice people. The problem is a lot of them are not the brightest bulb in the bunch, and you're going to come across people that give you really, really bad advice, and they're going to get into this metaphysical shit, and they're going to talk about auras and all this other stupid hippie shit, and it's garbage. It's like, you know, make sure you don't get sucked into that unless you're already one of those people. Then hey, you go have fun with these other stoners that are just like living in fucking another world or whatever. But you're gonna hear some dumb shit. You're gonna hear some dumb shit. You know, somebody once told me, hey, if you have a panic attack, you know, during the time that you're smoking weed, just, you know, sit down on dirt, because it, you know, marijuana is a grounding drug, and and as long as you're touching the ground, everything's okay. It's like, dude, just give me the fucking weed and get out of my face, you know, because it's like, that's stupid shit. Will you have panic attacks or anxiety attacks on weed? Maybe, right? It depends. Typically it's the strain that will cause that, and also the current mood that you're in. Sometimes weed, if you're an anxious person, will calm you down, right? But there's also times that you might end up getting a little bit of an adrenaline rush, and you might end up having a little bit of anxiety from smoking a little weed. It's not unheard of. But no one has ever died from smoking weed, ever. No one's ever died from it. The panic attack is short-lived, or anxiety is short-lived, and then that's that. And in worst case, the weed wears off in 2 hours tops. So, you know, it's not like if you're doing like some type of weird LSD or mushrooms or something where you think that the world is melting. It's nothing like that at all. It's nothing like that at all. You are very, very much in control of everything that's going on. You're well aware of everything. One of the things that you'll probably notice is time warps. That's what I call them, time warps. Your memory, short-term memory, is very modified, and it seems like you're going through time warps and shit like that when you're on it. And that's normal. You get used to it, and it's not so bad. When you're dealing with high CBD content, you don't get that stuff as much, right? But it is what it is. Don't get sucked into this whole thing of where you have to have a super $500 bong and stuff. You don't need anything like that. A simple little you know, bong or something like that is fine. You don't need to spend a lot of money. You can even do the zigzag thing, whatever. You don't. That's for super stoners, right? The super stoners, the people that do this, like, it's almost like for a living. It's like, this is, you know, every day. They call it wake and bake. They wake up, they just start smoking until it's time to go to bed, and they do the same thing the next day. If you're thinking about, if you're an adult, the way that marijuana will affect you is completely different than if you're a child. Typically, as an adult, it does not destroy brain cells. It doesn't do anything along those lines. If you're a child or something along those lines and you're smoking, it can alter the rate of growth within the brain. It can modify things in a negative way if it's a child that is ingesting it. So that's something to keep in mind. So if you're buying it, if you're thinking about doing this for your child who's in pain or it's got cancer or something like that, just keep in mind that you want to kind of minimize the amount that the kid's being introduced to it, because it can modify biologically some things that are, it's not that great. When you're an adult and you've already been fully developed, it's completely different. But don't believe me, you can do the research on it. And then the way that marijuana works, because a lot of people don't know, it's kind of like an SSRI, where it looks like a neurotransmitter. That's ultimately what it is. It looks like one, and they call them. It affects inside the brain. You have a bunch of receptors within the neurons and stuff, and you have neurotransmitters. And these neurotransmitters, when they hit the receptor, it tells the nerve to do something. It's almost like a little program, do something. And you know, we have serotonin and you know, norepinephrine and all this other stuff like that. Is it norepinephrine? I think it is. But anyway, you have dopamine and things like that. But you have all these different neurotransmitters, and they tell that stuff to do something. Well, they discovered that there is a neurotransmitter that is very similar to the shape of THC, CBD, etc. And they call these cannabinoid receptors within the brain. The only reason why they call them cannabinoid receptors is not because it's meant to use cannabis. It's just that there is a neurotransmitter that we naturally create that is very similar to the shape of cannabis, and because of that, that's why they just call them cannabinoid receptors. It's not because we're meant to do it, but because that's the way that it works, is it just kind of ends up working with neurotransmitters. That's why it can't stop your heart or your lungs or anything like that. You can't die from it because it only affects certain portions of the brain, and they have nothing to do with your heart, lungs, organs, and stuff like that. It has nothing to do with it. Typically, what it does is it alters the rate of, like, repeating. I guess you could say it, like, it alters the rate of repetitiveness within a signal. So, in other words, one of the things that might happen is you eat, then you get the signal inside there, and it says, you know, okay, you're cool, you're full, there's no reason to eat anymore, you're full. So, cool. But what the cannabinoid, when you smoke your weed or whatever, and it goes inside there, it can kind of block that. So what happens is you still feel hungry because it blocked that. That's why you'll feel hungry. And it also does things for your short-term memory. It'll block things, or it'll cause them to reactivate a number of times. And so this is why you end up getting like time warps and stuff. But the way that it functions, it's just like a neurotransmitter, and you can't die from it, anything along those lines. So, you know, don't be too afraid of it. The worst thing that can happen is maybe an anxiety or panic attack during the time that you're using it, and it doesn't happen to everybody, and even if it does, it's a one-time event, right, and it'll go away. You should, the first couple of times that you do it, you might want to do it in an area that you're comfortable. If you're by yourself, great, and if you're with somebody, great. Just do it in a way that you're comfortable. Just have your stopwatch with you so you can keep track, because if something goes bad, you can always go 2 hours. The chances of something going bad are like very slim. And when I say bad, I don't mean you're going to end up in the hospital. I just mean bad, like you might have an anxiety attack or something. Because especially if you've never felt the experience before, you might like, oh my God, what's next? What's going to happen next? I don't like this. What's going to happen next? Right? But it goes away. You get used to it. Just like drinking alcohol or something the first time you get buzzed. It's kind of like that. Yeah, so you end up, you know, you end up smoking some or whatever, and either it's going to work or it's not going to work. And then what you should do is keep a little pad and paper with you, and every strain that you try, put down the effects that worked, that, you know, were good, write down the effects that were bad, how long it lasted, you know, and whether you think that you should try it again, right? And that's what I did until I could find a couple of strains that I thought were okay. And I kind of stick to that. But, you know, getting into the world of medical marijuana, you're going to indirectly be sucked into a world of stoners. And it's not necessarily a bad thing, but like I said, bad information. They have a lot of bad information, stoners. They create some weird shit in their head about like how reality is and stuff. It's just like, wow, that's not how it is. That's not the science behind it. So anyway, this is a long video and stuff, but yeah. If you're going to start doing the medical marijuana, make sure that you get your card or you get your recommendation. You don't have to have the card, but get your recommendation at least, so that way you're somewhat protected by the law. Remember, federally, you cannot have it, so you cannot go through border checkpoints. If the Border Patrol pulls you over between California and Arizona and they find even a small amount, remember, they're federal. Okay, that's a big no-no. Never travel with it outside of the state. Make sure you don't travel with it anywhere that you know that they might have Border Patrol. Here in Southern California, there's a whole bunch of them. Never carry any more on you than you need to. In other words, you know, California allows you to carry a lot, you know, but unless you absolutely need it, don't carry any on you, right? And if you do, only carry the exact amount that you need for that particular trip or something like that. Don't carry more. Just in case you get pulled over by somebody and they're being a jerk or something along those lines, the less you have, the less grief they're going to give you. Let's see, what else? Don't tell anybody. You know, don't tell anybody that you've got your medical card, or you have any weed or anything like that, except other people that are also sick that are using it as well. They call them collectives, and here in California it's a collective. And so when you end up going to a dispensary, it's actually a collective, and it's just a bunch of people that are in the same position that you are, that supposedly grow the marijuana, and then what they do is they all put it in a big pile, kind of, and everybody shares it. But that's not really the way that it works. It's just there's maybe like 1 or 2 growers, and everybody joins the collective, but they're making the money off it, and they call it donations because you can't legally sell it. But you know, everybody always tries to find loopholes. And I can't think of anything else right offhand that, you know, I could tell you about it. I mean, I'm trying to be completely honest with you. People will tell you all sorts of stuff. They'll say that it cures cancer and all. It's like there's really no evidence to support any of that. People will tell you that it's an anti-inflammatory and all this other stuff. There's anecdotal evidence on a lot of this stuff, but it's like it hasn't been validated yet, right? And so be careful where you get your information. Do the research on this stuff. If you think it's a good choice for you, give it a shot. You know, give it a shot. It's not going to hurt anything. And if you don't like it, then don't do it. But at least, I would say at least try if you think it's going to better your life. Because, you know, I had no intentions of ever smoking weed again. The last time I smoked weed was back in the 90s. And I had no intention of ever smoking it again. But after I got hit with MS, after about 2 years, I said maybe I should consider it. You know, because I'm looking at some of the evidence. It looks like it might help, and it kind of does. So, you know, if you're thinking about it, you know, give it some thought, do the research, whatnot. And if you have any questions on it, I'll do my best to answer them. You know, I mean, I covered a lot of stuff, and I'm talking a lot in this video about it. But I think it's an important video, especially for people that are just starting out and they're thinking, I've never smoked weed before or something, and I'm thinking about this, I've got this disease, and you know, what should be the next step? And that's kind of why I'm doing this video. You know, but like I said, if you have any questions or anything about it, feel free to ask, and I'll do what I can to answer them. And I'll try to give it to you straight without bullshitting you, because when it comes to marijuana, there's some people that it's almost like a religion. Like if you end up telling them it's something negative about marijuana, they immediately jump down your throat and they tell you you don't know what you're talking about, and there's so much research that says otherwise, and it's kind of like it's looking through life with rose-colored glasses. In other words, they're not really being completely intellectually honest. Like they're not being, well, not intellectually, they're just not being honest about the thing, because weed is not perfect. Right, it's not perfect, but it's also not as evil and you know, unhealthy as a lot of the people claim that it is. The people that are anti-weed, it's not even close. Right? They always say, you know, the truth is somewhere in the middle. Well, the truth is closer on the sides of the stoners, but the stoners, they miss certain things that, you know, because there's certain detrimental aspects to weed too. Nothing, like I said, nothing is perfect. Too much of anything's a bad thing. But anyway, guys, okay, cool. I guess I will just talk to you guys all later. And until next time, take care.